Yay, we're good. Hi, how are you?
I'm good. How are you? It's so nice to see you in person, kind of virtually.
Yeah, nice. I'm so happy about this. Thank you so much for doing this. I'm so excited.
Thank you
Um,
for asking me. Any chance I get to talk about music therapy, to talk about what music therapy does, I'm 100% in, and I love that everything you do is evidence-based. So I'm super excited to share everything music therapy related with everyone.
awesome. Okay, great. So let's just get started then. Is my voice okay? Like the volume and everything? Okay,
Yeah,
you
got
sound
me.
great too. Okay, awesome. So everyone, welcome to Madison Green's Wellness Expert Interview, Episode 3. Today's guest is Mariagracia. Did I say that right? Okay.
You sure did.
She also goes by MG, Mariagracia Rivas Berger. She is a board-certified music therapist. She works at Children's National Hospital. Am I right? Okay, good. So yeah, let's just dive right in. So can you share us your background story? Like what inspired you to become a music therapist and how did you become one?
Yes, of course. So I'm not sure if you know this, but I was born and raised in Lima, Peru, and we
Oh,
moved
wow.
to the States when I was 11, and then after being there for a couple of years, we moved to Virginia. So between all those life-altering moves, I didn't really have an idea or even think about what I wanted to do with my life. So when it came to high school, I just knew that I loved music and I loved singing. And so I got it in my head, I'm going to perform, I'm going to be an opera singer. So then fast forward, I got accepted into the Conservatory of Music at Shenandoah University. And right away, a semester in, I knew that it wasn't for me.
Mm.
I I very much liked opera and singing, but there was something within me that knew that I didn't want to perform for the rest of my life. However, I didn't know what else to do. I think this is a common theme that we see a lot in South America and in a lot of other countries, United States included, that you think of music and you think of performing and you think of teachers. And I personally did not even know music therapy existed until I went for my undergrad to Shenandoah and met a lot of people that were majoring in music therapy. So I finished my 4 years as a vocal performance major, and I took a year off to really delve within and see what I wanted to do. During my graduate experience, I was very focused on sexual assault awareness and women's studies, and that's where I realized that I really wanted to be in a helping profession. And so in that year off, I did a lot of research. I knew deep down that I did not want to do something that didn't allow me to do music, but I also didn't want to perform. And then I found music therapy, did a lot of research, read a lot of studies, interviewed a lot of music therapists. And that's when I realized, okay, I think this is it. So I, long story short, went to school for a master's equivalency, not a master's. And after 2 years of a lot of studies, I had to do a case study. I had to do 1,200 clinical hours in different places. Then I qualified to take the national boards exam for music therapy. And then I became a music therapist. And then I went back for the master's. And it varies per state how long it can take you or what you have to do. But to become a music therapist, you technically have to go to school for music therapy, and you have to do 1,200 clinical hours, different places, not just one, so that you can have experience in working with people with different diagnoses. And then you qualify to sit in the national boards. And then after that, the rest, I guess, is history. And, it really is almost like a dream come true to find a career that you're so passionate about. I feel very fortunate because that's not something that everyone has. I remember sitting in my first music therapy course, which was an overview of a lot of things. And I remember, this is so cheesy, but when people say you find the one for the love of your life, I very much felt that way with music therapy. I was there, I felt like the clouds were parting, and I was like, this is it.
Yeah.
This is what I want to do for the rest of my life.
That's
And
a really great feeling.
yeah, and you know, I go into work every day and I feel so incredibly lucky to do something I love and something that impacts people on a daily basis.
That's wonderful. I was just so curious about when we first met over Instagram, like I guess about 6 months ago now, right when the pandemic hit, and
Yeah.
I was just starting Instagram for Madison and Green for the first time, and you were just like so friendly. I had never made like friends over Instagram before, and you were truly my first friend on it. Like, and I was just so excited to learn more about it. So I'm so excited to be doing this. And unlike you, music really wasn't a huge part of my life. Like, I grew up listening to my parents' CDs, like in the car, not even like at home. Like, there were Beatles and OMD and AHA, and it was just kind of like all over the place. It's like whatever CDs they were putting in the car. And so music, I don't know a lot. I did practice piano, but you know, it was more of a hobby level, and I haven't done it in ages. So the book you recommended, this guy over here, I haven't been able to finish it. It is an intense book, but it was also really, really fascinating because like you were saying, that I'm very evidence-based, not very, because I do understand the spiritual side of it and everything
Of
too,
course.
but I do appreciate the studies that, you know, get incorporated into all these methods and wellness tools that people can have. And this was a really fascinating book. It took apart music in many different ways and how it affects your brain. And it was a fascinating learn on how music affects your mind and which part of the brain affects. But can you share more about what is music therapy, right?
Yeah.
So like, is there a difference between is there like a live version that's better? I mean, you obviously do a live music therapy, but is there a difference between, you know, live versus a recording, and like, you know, whatever you can share about music therapy in general?
Of course. So music is beneficial, I would say, for everyone, you know, unless, and I can talk a little bit more about that later, there are contraindications of when you should not be using specific types of music based on who you are. It's not one puzzle, you know, fits all. Music therapy is the evidence-based practice. And when I say evidence-based, I mean that there's been, you know, research showing that music therapy interventions work for certain things. You know, even a lot of music therapists do the, you know, focus on the spiritual side of things. And even that you can say is evidence-based based on what research has shown us and what the quantitative or qualitative studies have shown us. So music therapy is the therapeutic relationship between a board certified music therapist and a client or patient, and what the music therapist and client are doing in the session to reach the individualized goal. And that sounds very broad, but I say this as the typical definition when people ask me, because people typically ask, what is the best song to reduce anxiety? What is the best thing to do to manage your pain? And I feel like the answers I give, you know, are never one, because it varies from person to person. What I might do for a patient that is a 17-year-old with a pain crisis in the hospital might be very different for a 17-year-old with the same crisis, based on who they are and where their pain is and what they need in the moment. So it really varies from person to person. I have recorded, so all of my sessions are live, whether it's in person or through telemedicine, which we do now at the hospital since the pandemic hit. But I have, however, based on my relationship with the patients and what I know about them, I have recorded you know, imagery scripts with specific pre-recorded songs that I am not playing live, so that they have access to this when they are not in the hospital, based on our experiences with this specific script and music together. So I don't know if that answers your question, and I can talk a little bit more about my work with specific patients, but essentially that's what music therapy is. You know, it's, a lot of people say, like, can I do music therapy to myself? And, you know, they're not music therapists. And I say, you can 100% use music in a therapeutic way for you, but that would not be considered music therapy, just like me doing exercises that my physical therapist gives me, I'm not technically engaging in physical therapy, or me doing my activities that my therapist or my psychologist has recommended to me, I'm not, you know, having a psychology session with myself because a psychologist is not there. So it's very similar to everything. I see someone's asking a question. I don't know if we should answer them as they go.
Yeah, absolutely. Any good articles, techniques you would recommend? Yeah.
I have so many articles that I can send to you, Jasmine, and you can send them to people depending on what you are looking for. So some of my favorite articles are based on pain management. I also love any hospital-based interventions that music therapists have used. So I have more than hundreds of music therapy studies that I'm very passionate about, that if people want to, you know, specify what they're looking for, I can send them to you for you to send to your followers.
Yeah, just send us a message, either of us, if you guys want any articles. Yeah, for sure. I'm a social worker, so I'd love to learn. Okay, well, you're in a great place.
Love social workers. I work with them every single day, and I love how we collaborate to really treat all of our patients. So more than happy to help you.
So can you tell us a little more about what your day would look like? So you walk into a hospital, so you work at Children's National Hospital. So I guess the age group is between, does it include infants up to 17, 18?
Yeah.
Or, okay.
So I work with itty bitty babies. I've even worked with patients that are a month or two old based on their diagnosis. So I work very specifically in the Center for Cancer and Blood Disorders. So any baby that might have a blood disorder or some type of cancer diagnosis are going to be in our hospital, either admitted or in the clinic. And I've worked up to people that are 30 years or so old. Wow. And that's because certain cancers are characterized as, or are known as, pediatric cancers. So a lot of the times those patients come to our hospital to work with our amazing doctors and specialists. So my day, I always say that I love my job because even though I have a work schedule, every day looks different because the hospital setting is impossible to plan for. So I go in, I check to see who's admitted, or I check my emails to see if I have any referrals. I will read a patient's medical chart and background. A lot of the times it's patients that have been admitted for weeks or months, and I've already worked with them, so I already know what they need in the moment. And then after that, I would kind of, you know, I don't want to say the word prioritize, but I would see who is, you know, who is someone I would need to see right away. If somebody is really struggling with coping, then I might see that person first before I see somebody else. Or if art therapy is going to be seeing a patient, then I might go check in on a parent and their baby so that I can really work on bonding. Because a lot of the times when you're in the hospital with a tiny baby, it affects the whole family, and parents have shared that they feel their role as a caregiver is very difficult in that situation. So we work a lot with caregivers and infants on positive interactions within the hospital. So it really looks different from door to door, but I still have, you know, my day is structured somewhat similar, but every single session is very different. So I always like to say I might go in to see a 5-year-old, and based on our relationship, that patient might show me, or we might be engaging in singing to every Frozen song or every Disney song in the world. And, you know, through those interactions and experiences, we are giving back a lot of control that the patient doesn't have. We are normalizing the treatment environment. We are allowing them with our coping and its overall association of the hospital. And then I might pop in to see my next patient, and I might be really just engaging in drumming and not really engaging verbally at the beginning or later on. So something that's really beautiful about music therapy in general, you know, there's that cheesy quote, where words fail, music speaks, and music therapy can facilitate experiences for self-expression, emotional release, relaxation, and so much more without a push for verbal communication. So, and I have so much more to say about other things that music therapy can do, but I don't want to ramble on too much.
No, I mean, I have so many questions. So, you said that you work with patients that are as young as 1 month old, just born. Obviously, those babies can't speak, right? So I guess as a doctor, probably would know that it's going through a physical pain, versus a mental pain. Like, percentage-wise, when you're doing music therapy for patients, is it for physical pain or like a mental pain, like anxiety, depression, or is it a mixture of both for every patient? Like, is music therapy better for one type of like physical or mental, or both?
It's definitely both.
Okay.
So if you are looking at the physiological effects of what music can create in the body, just I'm sure as the book you read, you can definitely target speech, you can target physical pain, you can target even a patient's vitals. Research has shown us that your heart rate will actually sync to a lot of music that you're listening to. So I might go into the
Wow.
care unit and try to work on a patient's vitals if possible, but also I go in to see patients every single day for their emotional well-being and how this diagnosis, whether it's sickle cell or a different blood disorder or cancer, is affecting them on their day-to-day life. And we work a lot on, sometimes just expressing how this is feeling through music experiences or through talking, or sometimes you just need a good cry and you've been holding back, and the interventions that I might use with a patient that day might allow for that emotional release. I was working with a caregiver. Their child was asleep and we have very good rapport, and we dove into a lyric analysis of a preferred song. And so I told the caregiver, I would love for you to highlight anything that stands out to you while I'm singing this. And the caregiver did this, and then she kind of talked about every single line that she underlined and just expressed so much about the specific history with the diagnosis and her past experiences before the baby was diagnosed. And she released a lot of what she had inside, and then she said, I feel so much lighter. And so after she released all that she felt, it was, and we processed through it verbally, then I took her to a different space, because I can't just leave her in this
Right.
very much in her feelings.
Yeah.
And then I asked her, what does lighter feel like to you? And then we moved musically to a different space, but also allowing her to honor all of these, not darker, but all of these feelings, because every human has a variety of emotions.
Right.
So I forgot what the question was now, but,
No,
we definitely target coping and mood and all of these, and we work hand in hand with our wonderful psychologists and social workers and art therapists and everything. So we all share what we see in our sessions, and we all chart in their medical charts based on what they did on our sessions. So we know, all of us, the psychosocial team and the Center for Cancer and Blood Disorders, we know how a patient is doing daily, and how we, using our knowledge within our practice, can really help treat both the body and mind.
Okay. So earlier you said that there's like no just one song that's healing, right? It's different for everybody depending on their age and their backgrounds. What's interesting I found in this book is that babies obviously have kind of a blank slate, right? They're not culturally formed when it comes to music. So when, let's say you're treating a month or 2 months old baby, what is the type of music you would play, and what instruments do you typically use?
So the type of songs we approach are always the parents' preferred music, and this doesn't go for babies in the NICU. Babies in the NICU, in order to be a music therapist that works in the NICU, you need a specific, you need additional training, which I don't have, and I only work in the Center for Blood Disorders. So if you are working with babies in the NICU, you might take a parents' preferred music and really change it based on what the baby needs. What that is, I don't know, but just as a side comment, you can work with babies that are premature,
Mm-hmm.
And a lot of NICU music therapists work in a lot of hospitals, not just to help the patients cope and aid in the bonding, but also research shows that NICU music therapy actually decreases the stay of the babies in the hospital because they help with their suctioning and other physiological factors. But back to what, outside of that, when I work with the itty bitty babies that are not, that are not in the NICU and that are in our unit, I always take a parent's preferred music. I always tell parents the baby prefers your voice. It's what they've been listening to before they're even born. So let's take your preferred music and let's work with that. The instruments I use, I have a little baby ocean drum that every single baby I've worked with loves because it has the visual stimulation and all the different shapes and colors. And then it's also very soothing. Or if they have a lot of energy, they can tap it. So they're working on their gross motor skills and they're having fun, and we're engaging with the mother or the father or the grandmother or aunt or whoever's there, whoever's the main caregiver, in positive experiences. And then I might also use pre-verbal vocalization songs, a lot of oohs and ahs, in order to elicit, if they are at the age where they're babbling, in order to elicit those communication. Because I always tell everyone, babies are musically inclined. That's just a fact of life. When you talk to a baby, you're not like, hey baby, how are you? How's your day? Right? The way you speak to a baby is in a way kind of musical. You're like, hi, how are you doing? So you have these different inflections, and babies respond so well to music. If most people sing to their babies, so babies already have some type of connection to the different inflections of music. So knowing all of that and knowing how music can activate the whole brain, we kind of use all of that in the family dynamic to really shape these positive experiences in the hospital, or to co-treat with physical therapists and occupational therapists based on a family's or even babies' preferred experiences, which sounds silly, but babies have a personality too, and they show you what they want and what they don't want through their facial affect.
And like you're saying, like babies have ability to kind of not read music, but kind of understand and feel, what am I trying to say? So basically what I'm trying to get at is I learned that the part of the brain, it's the primitive part of the brain that is affected by music. And people say it's the left side, but that actually happens after musical training or something, according to the book, that a lot of it is the right side of the brain, and it affects the primitive part of the brain. So obviously the babies already have the ability to kind of understand rhythm and tempo and, the pitches. But when you're working with like teenagers who already have kind of a formed, taste in music, right? Yeah. That's not necessarily their parents' music. Do you speak one-on-one with the patient and, decide which song, or is it about the kind of the tempo? How does it work? Is it like, can you play me, Michael Jackson, because that's what I like? Or is it like, okay, so you like this kind of music, so how about this? Like, how does that work?
Yeah, so everything is based on a patient's preferred everything, right? Okay. So I go in and I'm going to assess how they're feeling, what they're showing me that they feel. I always look at the monitor to see, if they're in the ICU or if they're connected. I want to see what is my role there when I walk in, because my role one day might be to help them with their pain, but it might immediately go into how they're coping outside of the hospital. So I go in, I get to know them, because 50% of music therapy or all therapies is your relationship with your patient. And I get to know them like I would anyone else, and they might share what they like. And then I might use that and dive into a lyric analysis if we're working a little bit more on how they're feeling. If we're working on pain management, I might go ahead and just ask if I can play them something soft and guide them through a relaxation experiences, and they might say yes or no, and that might lead into more of singing-based interventions to target their pain. So to answer your question, it's all about what their preferred music is, but also what they need in the moment. And honestly, you might think like, oh, this rap song with all of these curse words and really fast tempo, how is that going to help with their pain? Well, actually, because that's their preferred music, and if they have positive associations with this song, then we are going to use that to benefit them, because slow music, when somebody's telling you to breathe, might actually increase your anxiety if you hate that type of things. If you are not used to doing these things, you might feel like you're being forced to do something else, and in the hospital you already don't have a lot of choice, you know. So it is everything we do is patient preferred.
That makes sense. Have you ever worked with someone who was like in a coma or couldn't speak or couldn't see, but you know, and you just kind of had to figure out which kind of music you play for them? Or
so parents or caregivers are typically at bedside, and they typically tell me what a patient's preferred something is. I have, however, worked with patients that can't see or can't speak due to brain injuries or due to being heavily sedated. So I always go off what the family might tell me, or if I go in and there's no one and I have not met anyone, but I've received a referral for relaxation, I might just improvise something on the guitar and do soft hums. I would never just assume a song, because music can actually also be, music's wonderful, but it can also be really bad if you use the wrong, I mean, the wrong type of music, meaning a song can be triggering in a negative way to somebody that has a negative association with it. So when, you know, somebody wants to play music for somebody but doesn't know anything about them, I always try to educate our medical staff or any performers, you know, reminding them specific music can actually be emotionally triggering in a negative way, and that is going to maybe increase somebody's heart rate and kind of move things out of whack. That's why the relationship is so important too. But you know, you do know that music activates as a whole the whole brain. You know, you think that it only activates the auditory areas, but due to how rhythm and tonality is processed, it also activates the limbic areas, which is also associated with emotions, and timbre activates the area of creativity, and music also activates the hippocampus, which is the memory center. So there, you know, everything is really quite fascinating, but you have to incorporate all of that within somebody's preferred music. So music therapy work knowing all of this to reach whatever the goal is in the moment.
Right.
It's super complicated.
No, but it makes a lot of sense too, because even in aromatherapy, you have to make sure that a scent, let's say pine, you know, is most likely very soothing for many people, but some people could have terrible memories attached to it, right? So once they inhale something that's supposedly good for you, according to a textbook, can be a trigger for really bad emotions and memories. So, you know, it's all about basically working with the patients, like you've been saying. So it makes a lot of sense. What do you think music therapy offer that other types of therapies can't offer?
Okay. So, you know, I mentioned that music is a way to express and cope without a need for verbal communication. I work a lot with psychologists, and we work so closely that if, you know, for some reason a patient at the beginning might not want to engage verbally, I might go in, and through our sessions, a door might open for verbal communication, and then working along with the psychologist, we can, you know, help them cope once they're open to verbally communicating. But music is also a universal language, you know, and I see that in my daily work. I work a lot with patients from different countries that might not speak English or Spanish, but they have some type of positive connection with specific music. So that's also something that, you know, you might not get with a lot of other things. And if you add on how music activates the whole brain, just like how I talked about, that's something else that maybe not every therapy has. And there's so many therapies out there that is great, But with music therapy, the fact that NICU music therapists can work with even premature babies in order to help their help decrease their stay and help with everything that is going on in the hospital, that's something very particular that you don't see, you know, with other types of therapies. So I think if you incorporate all of these things, music therapy is such a safe space for people to really have a different avenue of coping. Also, and I love this, sharing this specific story. I don't know if you've heard of Gabby Giffords.
Yeah, please share. Yeah, because I watched a video and everything, but please share with the audience.
Yes. So Gabby Giffords suffered traumatic brain injury because she was shot and lost her ability to speak. And so when she was engaging in speech therapy, she physically could not say certain words. However, she also worked with a music therapist along with speech therapy, right? They're both so equally important. She had the ability to sing certain words that she couldn't physically say. And so music, because it activates all areas of the brain, while you can't fix the neural pathways that were lost, you can create new neural pathways.
Right.
And so the speech therapist and the music therapist work together in order to regain her speech. And, you know, she also plays an instrument, so she works a lot on her breath control through that. So music is insane. Music, and, you know, not just emotionally, but physically too. And the fact that there is a therapy out there that can help you not just with your emotions, but also regain speech and work on memory and, you know, also foster positive experiences is just mind-blowing to me.
Yeah, it's fascinating. And the fact that you can do it on your own, right? This is not a surgery where they're rewiring the brain and, you know, making new pathways and all that. I mean, it's a tool to actually help heal yourself, right?
So you work with your, oh, sorry, go ahead.
No. I was going to say, I remember watching the video and just getting goosebumps because I remember, I forget what the word was. Let's say it was apple. She couldn't say that word. But if it was part of the song, then she could just sing it out. And it's just like watching that is just, you know, it's not creepy is the wrong word, but it's just like amazing that the brain is working in different places, and that's obviously happening.
Absolutely. Yes. And that's also something that makes me love music therapy even more. I before working at the hospital, I worked into school with students with varying diagnoses, whether it was autism or they had some type of physical ability. I worked with a student that had music therapy on their IEP, and the student didn't really speak and could not see, and also had a lot of other things that we needed to work on. And this specific student would not eat anything other than 2 types of food. So in the IEP, it was to try a new food. So I wrote a song for her, and it included the other senses that she had, which was touch, smell, and then eventually taste, which would lead to that. And the student had never wanted to try anything. Within 3 sessions of using that song and the familiarity of the melody, the student started to hum the melody and actually tried different foods within 3 sessions, or 2 to 3 sessions. So the IEP goal was reached like that because of the music that was created and also the familiarity with it. So it is absolutely fascinating what you can do, even songs that you are making up for your patients. So yeah, I mean, I had a caregiver tell me, this is the first time I've ever heard my kid say this word, and it was based on the music. That the goal was to work on communication, and they weren't really achieving that with other therapies, and music therapy came in the picture, and we worked a lot on speech and, you know, within our familiar or new music structures. And then, you know, I remember the mother sending me an email. This is the first time I've ever heard my kids say the word happy. I've never heard my kids say the word stop. And we were using all of these speech goals within music therapy. And it is, you know, based on what was comfortable for the student, based on how it activates their brain, and based on so many other factors.
I'm just getting like goosebumps as I'm listening to all of this. So I have another question on my
Mhm.
list. Can music help relieve anxiety? Obviously, it does. For those that can't hire a music therapist for their children or for themselves, can't go to a doctor's appointment, and if they're just at home feeling anxious, and let's say they're not musically talented either, or their parents aren't,
Mhm.
what is using the concept of music therapy, how can one help feel better or relieve anxiety at home using the music? Yeah. What do
Yeah,
you?
yeah. So it's using music therapeutically, not really music therapy because if they don't have access to it, which is such a bummer. And I hope that there's some type, maybe in the future that everyone has access to music therapy, because I do think it would benefit so many people of varying diagnoses. But if you're in this situation where you're feeling anxious, you don't really know where to turn to.
Mm-hmm.
I say, sometimes making a playlist. I do this a lot with my patients. Um, we might make playlists based on different moods or based on what you want to feel. Um, Familiarity actually really helps with anxiety. So listening to those preferred songs that make you feel at peace
Mm-hmm.
is really important. I would say try to do that. I would also say work on your breathing,
Mm-hmm.
maybe in rhythm or not. If you don't really know how to follow rhythm, just focusing on your breathing, closing your eyes and focusing on the lyrics or the music that you're listening to can often help ground you. And I know that people are very self-conscious when it comes to their singing, but I always say try to sing along to a song, because
Mm-hmm.
a lot of the times you are able to release a lot of what you're feeling. You're feeling anxious, but where's that anxiety coming from? Really listen to your body. And a lot of the times, if you are able to lean into music, you might be able to release some of that too.
Mm-hmm. Um, okay. So, like, let's say I'm putting on, like, I don't know, meditation playlist. Like,
Okay.
that is a form of music therapy, right? If you're enjoying it. So it's really ultimately what makes you feel comfortable and what soothes you. But for those that don't know how to even search for music, let's say, typically they listen to rap or rock and roll, but they know that that's not really calming for them. Is there a keyword you know, you would recommend on Spotify, let's say? How do you search for it? Because I actually myself have this problem a lot. I'm always typing in like meditation, and then it's like, just so many
Yeah.
genres, and it's anxiety inducing too, because you're like, you don't know if you will like the music.
Mm-hmm.
And
Mm-hmm.
what is a good way to search for it?
So I would stray away from saying that that you're using music therapy on yourself if there's not a music therapist present. However, I think it's very it's okay to say I'm using music therapeutically, because otherwise, because music is such an easy access for people, just music in general. A lot
Right.
of people say like, "Oh, I'm doing music therapy," but actually they're not. They're using music therapeutically, and I think it's
Therapeutically. Yeah. Okay.
to with to use our vocabulary in a correct way.
Right.
But however, if they're listening to rock and roll and that is soothing to them, I would still say continue to listen to that. However, if they are looking for something that is softer and slower pace, because meditation music might be helpful for you. And I was just talking to a patient about this actually. They said, I listen to just instrumental music because it calms me down, but when I want to express my joy, I like to sing. So that's a lot of self-awareness that some people might not have. If you want to listen to your preferred music, but that's not really doing it for you in the moment, you can listen to instrumentals of your song, or you can actually just listen to new songs from, hold on, let me try to think about this right. If you're feeling anxious and you don't even know where to turn to, and your typical music is not making you feel better, I recommend maybe thinking of a movie or experience that has helped you feel well in the past, and what music can be associated with that. So for example, I sometimes meet patients and they're like, "Oh, I don't really use music like that. I just use it for fun."
Mm-hmm.
Um, However, as I continue to work with them, I realize that they do use music on a daily basis that is comforting to them, but it's typically background music, or it's embedded in music, it's embedded in movies that they, you know, emotionally cling to. So I might extrapolate the music from the movie and incorporate it in their everyday listening or in an intervention that we're using. So I would say music is all around us, but we're not really aware of that. And just thinking about what movie or what experience you can think of that helps you feel at peace, and maybe thinking of music that is around that is really nice. Or maybe, you know, reaching out to a music therapist that's on social media and see what they might have to say, because while they don't have, you know, access to a lot of things, a lot of people have already created playlists on Spotify that they might have access to, and as you listen to it, you're gonna, you know, almost right away know, oh, is this enjoyable or not, you know?
Right.
I don't know if I heard it.
Yeah. And I mean, listening to songs that you're familiar with can be therapeutic, but would you say that there's a difference between live music, you know, where the musician's right in front of you, versus a recording?
Yes. So yes, depending on what you're working on. I always say that live music is so incredibly beneficial because you can change it in the moment as a music therapist. So if I'm working on someone's gait and I want their gait to, you know, increase a little bit, I can change the music in the moment, and I can't do that with pre-recorded music. Just like if I'm looking at someone's monitor, I might change the tempo, the speed of the music based on what I'm trying to do, or based on what I'm seeing. So that is the beauty of live music, that I can change words or that I can change certain things based on what I know the patient needs in the moment. However, I would not stray away from pre-recorded music, because a lot of the times, once again, the familiarity of it is what triumphs the live music. I had a patient that could not see, but music was very, very important to this patient. And me playing it live was actually a disservice of the familiarity that she had created. So this patient knew what songs, what singers, and, you know, she had a little playlist that the patient would, you know, want to listen to anytime they were nervous before a procedure. So it would be a disservice for me as a therapist to say, actually, no, I'm going to play it live, because I already know that the pre-recorded music was what was beneficial for this patient. So incorporating different interventions within the pre-recorded music was what that patient needed. So it's really, you know, it depends on what the goal is and who the patient is.
So,
go ahead. I was going to say, yeah, there were a couple of questions that I feel
Yeah. Let's get back to it. Okay, here we go. Do you use certain sounds that feel calming to someone, like city sounds or crickets, etc.?
Yes. So I often will write imagery scripts using very specific songs. And a lot of the times, if I'm doing, for example, an imagery script of the beach, I will use a specific song that might have waves in the background, and then, you know, put it on the speaker just to make it a little bit easier for the patient to imagine that they are in that space. So I do think that depending on, again, what my goal is, that is really beneficial. I personally have not used just city sounds or crickets or anything, but I do use songs that have specific sounds if they go hand in hand with the script that I've created or that I'm using.
Okay.
And then another question I saw from the same person, I'm so sorry that we answered it before. How do I prepare for meeting a new patient? And I must know a lot of songs. Yes, honestly, I feel like I do know a lot of songs because I have to. If a patient tells me that a song is very important to them, it is my job as a music therapist to learn it. So I might not remember what I did last week, but I can whip out, you know, songs from so many different artists because it is my day-to-day job. So it's really funny. But to prepare for a new patient, I will typically read the chart that the social worker has written, you know, their assessment, and I might read their history, their physical history, so I know, you know, a little bit of background on them. And then after that, it's my assessment as a music therapist when I'm walking in and as I'm building rapport with them. So while I can prepare so much reading certain things, the initial interaction is the most important one.
Okay. I think those were all the questions we had, right?
Yeah.
for now. Okay. All right. I mean, there's a lady who is a social worker. It wasn't a question, but she said she would love to learn more. I'm not sure how the system works. So you said you work with a psychologist and a speech therapist and a social worker. Are they all typically in the same room? How does it work? Do
So
you like ask one? Sorry, go ahead.
no, it's okay. So in the Center for Cancer and Blood Disorders, specifically at Children's National, we have a pretty robust psychosocial team. So we have social workers, we have art therapists, child life specialists, psychologists, specifically education specialists too, specifically for the Center for Cancer and Blood Disorders. And maybe we'll co-treat if we are planning to, but outside of that, we are always in communication through email or in person. But physical therapy, occupational therapy, they're hospital-wide, so they work with all the floors and all the patients. However, I have a pretty good relationship with our physical and occupational therapists, and they know how to reach me if they feel like they need an increased engagement from a specific patient. You know, if they're having difficulty engaging a patient and they obviously need to work on their physical and occupational goals, then I might co-treat in the moment with them. You know, I might meet them outside of the room. Sometimes we don't even plan to, and they come in the session. If it's appropriate, they might be like, actually, my goals today are walking and blah, 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 blah. And then knowing what I know about the patient from our interactions, I might facilitate certain interventions that might, you know, elicit certain movements, or they might be playing the drum and playing it up high and playing it up low. And so we are working together to reach those physical and occupational therapist goals within our co-treatment session. So we are always in communication outside, but oftentimes it might just happen naturally when they come in. People are always like, is this a good time to join? If I'm in the middle of some heavy processing with someone, you know, they know that it is not a good time to join. But oftentimes we are just engaging in music making, and the patient might be in good spirits, and it might actually be a great time to co-treat in those physical goals. I remember I had a patient that kept saying no to physical therapy. They did not want to walk. But during our session, the patient was dancing and running around, and we were singing. So when the physical therapist came in, I said, oh, this is my friend. We're going to, you know, she's going to join us in our session today. And so they were able to really reach their goals with the patient not even realizing they were engaging in physical therapy at the same time.
So, not every therapy is for everyone, right? So like even in aromatherapy, some people are very sensitive to smell. Some people, you know, just don't, you know, they have sensitivity and they just don't want to be bothered with smell as a therapeutic tool. In your experience, have you ever met anyone who just could not accept music therapy, or do you know of a type of a person that that music therapy doesn't work for?
I would say that oftentimes patients don't really wish to engage in music therapy, and it's not really, you know, and they just simply don't want to be, and their primary mode of coping might be art therapy because that's what they prefer really to express themselves. And that is absolutely okay as long as they have a main type of therapy that they can rely on. It is absolutely okay. It's not often that I engage with people that are, you know, completely not even willing to try music therapy, because music therapy is just not one thing. It's so many different experiences. It doesn't happen often, but it does happen, and it is absolutely okay. You know, music therapy, although it's beneficial for so many human beings, it's okay if somebody does not want to engage, especially in the hospital. We need to honor, you know, their ability to control the very, you know, even what therapies they engage in.
Right. Cool. Is there an experience, you shared a lot of experience with your patients from the past already, but is there anyone that pops up that you just are like so excited to share about? Or I don't want to put you in a spot, and it's okay because you've already shared plenty, but
I do. I just have so many. I know. That's
like a wonderful success story that you're just like so proud of that, you know, you want to share, or anything.
So one thing that's popping in in my brain is a patient that So many. Okay, but I was working. I don't know. I just don't know which one to share. But I was working on a patient for pain management. They were in for a pain crisis based on their diagnosis, and I was doing this music intervention which incorporates singing to their pain. And this is actually what I'm currently studying this at the hospital. And I told the patient to imagine their pain, was standing there, and they gave it a name, and then they started singing what they would say to their pain. And I validated them by singing back what they were saying. So not only are they visualizing this, but they're also hearing their own words being sung back to them. So it's so multi-layered. And then after that, the patient shared with me, this is something I had never shared with anyone. I felt like I had control of my body again. I felt not just pain relief, but also it made me realize that I was holding a lot of resentment towards specific people in the patient's life. And I remember walking away, I think our session was an hour. I remember walking away with this feeling of, wow, not only did we decrease their pain, but this patient just had almost a realization of what these humans in the patient's life had meant in relation to the pain. And I remember thinking, I just friggin' love what I do. Or, I could also even talk about how a patient lost their ability to speak due to strokes, but they still, their vocal cords were still functioning, and we could hear that when the patient was coughing or vomiting. And so I got a recorder, and we were working on breath control through the recorder, and that eventually led to humming, and that eventually led to vocalization. And I still follow that patient to this day to work on speech, because the patient benefits a lot from music therapy, specifically with speech. So the patient gets speech therapy and music therapy, and the parents always tell me, I'm so glad that we were able to have access to music therapy to really target the patient's speech. And, just so many experiences. But I feel honestly so humbled to work with so many wonderful families, and to even be, a part of their life, even if it's for just one session.
That's wonderful. It's such it must be so heartwarming to be able to, offer this service. It's an incredible skill to have. And I hope that more people will use music therapy at hospitals, even privately. Do you offer ever like a one-on-one session, or do you only work for the hospital?
I currently only work for the hospital Monday through Friday, and I'm a wellness coach on the side. So that keeps me pretty busy, but I've definitely toyed with the idea of doing one-on-one private sessions, just because so many people I think would benefit from music therapy. And I have, the experience with certain things that I feel like I would like to expand it a little more. So that's definitely been in my brain as of lately, but not yet, at least. There are private practices around, but I agree with you that I hope that there is a time in the future that there is a music therapist in every single unit of every single hospital, because it can help not just patients, but also their family members, and also even members of the staff who often join in sessions. And it helps the patient view them slightly different, not just as someone that might be doing something scary to them, so I can only hope, but we will see. And also studies have shown that music therapists, because they can help with pain, it can also decrease the pharmacological approaches to pain. So, we'll see, but I feel like this research is out there, and it can also help hospitals save money. So I think hospitals need to get on it and hire a music therapist.
And it's such a natural way, such less drugs you take, the better, right? Definitely, if it's not working for you. So, I hope for a bright future for music therapy. I think this concludes our interview. Is there anything else you want to add before you go, can people contact you with any questions after this session?
Absolutely.
Okay, cool.
Feel free to tag, if you share this, to tag me. My Instagram is MG Rivas Berger, or Berger, it's whatever my last name, but feel free to ask me questions about music therapy. I can always point people to certain studies, and I'm just so happy to advocate and educate for music therapy wherever I have a chance to. So thank you so much for asking me to do this.
No, thank you so much. I learned so much. I hope our audience did too. And I would love to do a chat again in the future and, get an update of what's been happening, and maybe you can share more experiences that you've had with us. And
sounds
great.
I hope that maybe next time we can talk about, hopefully our study will be concluded by then, and then I can share a little bit more about that.
That sounds good. All right.
Well,
well, thank you so much. Have a good rest of the weekend.
You too. Bye.
Bye.